Next, coding surgical and diagnostic procedures. Introduction. Accurately coding surgical and diagnostic procedures is vital for proper reimbursement and compliance. This module guides you through the principles and best practices for selecting and applying CPT codes for a broad range of surgical and diagnostic interventions, ensuring precise documentation and billing. Firstly, overview of surgical and diagnostic procedures. Scope. Procedures performed by physicians or other qualified health professionals, including invasive and minimally invasive surgeries, diagnostic tests, and therapeutic interventions. Next, types of procedures. Encapsulated with CPT codes ranging from minor outpatient procedures to complex surgeries. Next, structure and organization of CPT codes for procedures. Categorization. CPT codes are divided into sections based on the procedure type, code formats, typically 5-digit numeric codes. Some include modifiers. Next, sections include evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and medicine. Next, coding surgical procedures, types of surgical procedures. These include integumentary system, such as excisions and removals, musculoskeletal systems. Examples include fracture repair and joint procedures. Next, the surgical codes relating to respiratory, cardiovascular, and digestive systems, etc. Factors in coding. Firstly, approach to differentiate whether it's open laparoscopic or an endoscopic procedure. Next, site and laterality, extent and complexity, use of modifiers. It is to indicate bilateral procedures, repeat surgeries, or special circumstances. Next, coding diagnostic and therapeutic procedures. Diagnostic tests such as imaging, example X-rays, MRIs, biopsies, and endoscopies. Next, therapeutic interventions like procedures like injections, debridement, and minor surgeries. Key considerations: proper documentation of the procedure performed. Next, guidelines and best practices. Select the most specified code. Now, accurately reflects the exact procedures performed. Use modifiers appropriately to specify details like bilateral procedure or multiple surgeries. Next, consult documentation. Ensure provider notes support the code selected. Next, avoid upcoding or unbundling. Follow coding guidelines to prevent over or under billing. Common coding scenarios: multiple procedures, Append appropriate modifiers and sequence codes based on pair rules. Complex procedures. Follow guidelines for extensive surgeries or procedures involving multiple sites. Intraoperative and postoperative care. Apply modifiers and codes supporting global periods. In summary, accurate coding of surgical and diagnostic procedures requires understanding CPT code structure, precise documentation, and adherence to guidelines. Mastering these principles ensures appropriate reimbursement, compliance, and optimal working relationship with payers and providers. Thank you.